Bruce Willis's family has stated that the actor has frontotemporal dementia, FTD, a kind of dementia caused by a loss of nerve cells in the brain's frontal and temporal lobes. The 67-year-old actor retired after being diagnosed with aphasia. FTD is a horrible disease that many of us have never heard of and may strike anybody, the family said in a statement. Frontotemporal dementia comes in two major forms: primary progressive aphasia, which causes difficulty communicating, and behavioral variant frontotemporal dementia, which causes changes in one's personality and conduct. Professor of neurology at the University of California, San Francisco Dr. Bruce Miller said, "It strikes the portions of the brain that make us the most human." According to Susan Dickinson, the executive director of the Association for Frontotemporal Degeneration, FTD is the leading cause of dementia in those under the age of 60. She also said that around 50,000 Americans have been diagnosed with FTD. However, many specialists believe this estimate greatly understates the true prevalence of the disease due to its difficulty in diagnosis. Doctors diagnose it based on signs and symptoms in neuroimaging, as there is no specific biomarker or blood test for it. Ms. Dickinson has found that patients wait more than 3 years for a proper diagnosis. When does frontotemporal dementia often begin to manifest? Those affected with primary progressive aphasia may find it challenging to communicate effectively or to understand other speech. They may struggle with reading and writing. According to Dr. Ian Grant, an associate professor of neurology at Northwestern University's Feinberg School of Medicine, patients with the behavioral variety of FTD may exhibit irrational conduct. Patients seem like they've lost a little bit of their filter, he added, according on feedback from family members. Someone who rarely speaks up may suddenly curse at a stranger or make a rude remark about their looks. Dr. Miller warned that the individual can become indifferent and unmotivated as a result. Some people may also show a lack of compassion for persons in their immediate vicinity. The inability to multitask or plan ahead is a common problem for those with FTD. Dr. Joel Salinas, a clinical assistant professor of neurology at NYU Langone Health, has noted that frontotemporal dementia can also present in behaviors such as compulsive gambling and impulsive spending. Dr. Grant discussed how personality changes brought on by FTD can lead to reckless conduct and bad judgment, such as consuming an entire bottle of maple syrup. Perhaps they are demanding quick satisfaction, with no real way to put a check on that, he speculated. Dr. Grant noted that these symptoms might lead to a false diagnosis of a mental ailment like bipolar disorder. Nonetheless, there are a few techniques to tell FTD apart from mental disorders. It is uncommon, but not impossible, he added, for persons in their 50s and 60s who have no history of mental health issues to get frontotemporal dementia. The frontal lobes of the brain may atrophy or shrink in a person with FTD, although this is less likely to occur in a person with a mental disorder. Reasons for frontotemporal dementia's occurrence. Dr. Miller emphasized that genetics play a significant role in FTD risk, but that beyond that, the exact etiology of the disease is unknown in the vast majority of cases. Even those with a genetic predisposition to dementia can reduce their risk of developing the disease or slow its progression by maintaining an active lifestyle and social relationships, as well as participating in cognitively stimulating activities such as reading, crossword puzzles, language study, and musical practice, among others. Ms. Dickinson argued that there is no proof that any one activity may protect against FTD. Where may one get information on FTD treatment? Dr. Grant has estimated that the average lifespan of a patient with FTD is between 5 and 7 years after the onset of symptoms. No treatment exists, but there's a distinction between a sickness not having a cure and saying, "There's nothing we can do," he said. Patients with speech impairments might benefit from occupational therapy. Dr. Salinas also mentioned speech therapy as a potential method of aid for these individuals. Care plans for persons with FTD are generally developed in collaboration between the patient's treating physician and the patient's family or loved ones, and may include measures to prevent the patient from harming themselves or others. Some patients may be taken antidepressants to help with mood and behavioral issues, Dr. Miller added. Ms. Dickinson emphasized the importance of routines for patients. It's been her experience that support groups are helpful not only for patients but also for their loved ones. Physicians also have an active role in ensuring that their own families are safe. The family typically suffers as much as the patient, Dr. Miller remarked.